Good afternoon. My name is Pasipanodya Ian Machingura. I'm going to present to you on the prevalence of undiagnosed diabetes mellitus amongst hypertensive patients attending an outpatient clinic in Harare, Zimbabwe. Diabetes mellitus is amongst the largest health emergencies of the 21st century, and a third of hypertensive patients would develop diabetes mellitus, and diabetes mellitus is a challenge that it also causes complications. And the coexistence of the two, diabetes mellitus and hypertension, result in an increased risk and can accelerate the development of the vascular complications. A third of all people with diabetes mellitus are reported that they may be undiagnosed, and about 60% of the newly diagnosed diabetes mellitus patients are unaware of their conditions until they develop complication, which is a big health challenge. There is a paucity of documented data on prevalence of undiagnosed diabetes mellitus in high-risk groups, such as the hypertensive patients in a clinical setting in Zimbabwe. So the study sought to determine the prevalence of undiagnosed diabetes mellitus in hypertensive patients attending an outpatient clinic in Harare, Zimbabwe. The method, it was a cross-sectional study which we conducted at Paranyaka Group of Hospitals Outpatient Clinic, in which all hypertensive patients attending the outpatient clinic during the study period were given information about the study, and all the hypertensive patients who were previously not diagnosed of diabetes mellitus who consented to participate in the study were consecutively enrolled. We administered a questionnaire, and blood samples were collected from the patients into an EDTA tube for glycosylated hemoglobin analysis. And the glycosylated hemoglobin was analyzed using a Mindray BS800 chemistry analyzer, and the statistical package for social scientists version 8, the data analysis package, was used for analysis of the data. The definition of diabetes, for the definition of diabetes, pre-diabetes, and diabetes mellitus, we use the WHO definition for diagnosing diabetes mellitus using glycosylated hemoglobin. The non-diabetes mellitus was defined as an glycosylated hemoglobin level of less than 6%, whereas pre-diabetes mellitus was defined as a glycosylated hemoglobin of between 6.0 to 6.4%, and diabetes mellitus was diagnosed as a glycosylated hemoglobin of greater than or equal to 6.5%. 104 hypertensive patients were enrolled into the study, whose mean age was 60.91 years and the standard deviation of 14.06 years. There's 76% of the participants were on enalapril, and 24% were on atenolol antihypertensive drugs. And the mean glycosylated hemoglobin was 5.8% of the participants. There was no significant difference in mean glycosylated hemoglobin levels of female participants and male participants. The p-value was 0.335. Patients with the duration of hypertension greater than 10 years constituted 34% of the study participants, and 81 of the participants had no family history of diabetes mellitus. 86% of the study participants reported that they do not undertake regular exercise. And when we classified the patients according to their glycosylated hemoglobin, 26.0% of the participants were pre-diabetic, 22.1% had diabetes mellitus, whereas 51.9% were non-diabetics. The prevalence of undiagnosed diabetes mellitus was 21.1%, and among the previously undiagnosed diabetes mellitus patients, 56.5% were females and 43.5% were males. The prevalence of undiagnosed diabetes mellitus was found to be 22.1% among hypertensive patients, which is higher than that reported in Kenya, where they found a prevalence of 14% among previously undiagnosed hypertensive patients, and it was lower than 24% found in a study in Uganda, where they found a prevalence of 24% among hypertensive patients of undiagnosed diabetes mellitus. There is lower prevalence of pre-diabetes and diabetes mellitus are expected in developed countries due to their better glucose testing than what we would expect in our countries. And this is proved when we compare the prevalence of the diabetes mellitus among our patients with what was found in a study in Germany. They found a prevalence of undiagnosed diabetes mellitus among hypertensive of 12%. The higher rates of pre-diabetes and diabetes in developing countries are due to lack of rigorous screening, which leaves many patients undiagnosed, and beta blockers have been associated with new onset of diabetes among hypertensive patients, and we know they were among the drugs that were used by about 24% of our patients. Low exercise, even though combined with dietary intervention, decreases the incidence of type 2 diabetes mellitus in high-risk groups. But we know that in our population, most of the patients were not undergoing any exercise, which is a cause of concern that it might also cause the development of type 2 diabetes mellitus in them. Diabetes mellitus can be highly prevalent in hypertensive patients. Thus, there is need for constant monitoring for the development of diabetes mellitus, and further research using a national representative sample is recommended, since we know that this is a significant problem in our nation, as we found a prevalence of undiagnosed diabetes mellitus of 22.1%, and this can easily tip into developing complications. These are the references that I used. I thank you.